Congratulations on your pregnancy. At Natera, our mission is to provide you with essential genetic information about your baby early in your pregnancy. With a simple blood test, Panorama can screen for common genetic abnormalities, as well as determine the gender of your baby as early as 9 weeks into your pregnancy. The Panorama test is non-invasive, requiring only a blood sample from your arm, which means there's no risk to your baby. Once your sample arrives in our lab, we use advanced bioinformatics technology to detect tiny amounts of DNA from the baby's placenta. This DNA is then analyzed for specific genetic abnormalities. If the results are low risk, your baby is unlikely to be affected by the conditions that Panorama screens for. If you do receive a high-risk result, genetic counseling and follow-up testing is recommended to determine if your baby does have that condition. Panorama cannot tell with 100% certainty whether your baby has a particular condition, but it can estimate the baby's risk of having certain health conditions, as well as determine your baby's gender. And you can use Panorama regardless of your age or pregnancy history. Ask your doctor about Panorama at your next prenatal visit. Knowing if you are a carrier of a specific genetic disease can help you, whether with family planning, or your own medical care, or both. Most people are carriers of at least one genetic disease, even if no one in their family has the condition. Natera offers a simple test that helps identify people who are carriers for over 200 conditions. This test offers many different screening options, so your doctor may order the entire panel of possible disorders, or a subset based on your ethnic background and other factors. Many of the diseases Horizon screens for can be severe in childhood onset, while others may not be diagnosed until later in life. If you are planning a pregnancy or are currently pregnant, you may choose to have a carrier screening. You will receive a negative or positive result for every condition that you were screened for. A negative result means that no mutation was found for the genetic disease screened. This significantly lowers your chance to be a carrier of this genetic disease. The screening process consists of 3 simple steps. First, your healthcare provider will fill out a Horizon referral form. Next, you will have a simple blood draw. Finally, in about 2 weeks, your carrier screening test results are returned to your healthcare provider, who will go over the results with you. Horizon Carrier Screening gives families information about genetic risks to empower them to make more informed reproductive decisions.